Emily. I'm going to be doing a neurological assessment today. First, I'll assess the level of consciousness using the Glasgow Coma Scale. So when I look at him, his eyes are spontaneously open, so that's good. Then I'll test verbal response, so I'll ask him a few questions. What's the date?
The 17th of November.
Who's the president?
Donald Trump.
And what town are we in?
Stewartsville.
And then I'll have him squeeze my hands to test motor response. And so all that was good, so that gives him a total of 15, which is the perfect score for a Glasgow Coma Scale. Next, I'll observe his posture and position and his general appearance, which he's clean, has good hygiene. Then I'll ask, are you having any pain?
No.
And he shows no signs of pain with facial expression. Then I would check vital signs, see if they're within normal limits. So blood pressure, pulse, temperature, respirations, and oxygen saturation. Then I would test cranial nerve 2, which is visual deficits, using a Snellen chart. So can you read this line for me?
LPEDQRT.
So that's good. Then I will test cranial nerve 8, which is hearing, and I'll have him cover one ear and whisper in one ear and have him repeat the word.
Orange. Banana.
So that was good, no apparent hearing deficits. Next I'll look at his eyes and pupil assessment. So that's testing cranial nerves 2, 3, 4, and 6. So I'll have you look straight ahead and I'm going to shine a light in your eye. So that was good, and then I'll have him follow my finger, just with your eyes, not your head. Okay, it's testing lateral movement of the eyes. Next I'll ask about memory, ask him a couple questions to test recent memory and then remote memory. So what'd you eat for lunch today?
Chinese food.
And then what was your first dog's name?
Copper.
Okay. And while I'm listening to him talk, I'm assessing his speech pattern, which is testing cranial nerve 10, which is normal. Next, I'll test motor function. So I'll have you stand real quick and put your arms out and your palms up like this and close your eyes. And then I'd watch him for about 30 seconds to make sure that he's not swaying a bunch or gets really unbalanced, and I would stay here in case he would fall. That tests cranial nerve 8. Now I'll have you walk over here and back and see if his gait is steady. This tests cranial nerve 8 as well, and no apparent unsteadiness. Next, I'm going to test cranial nerve 7. Can I have you smile, frown, and then puff out your cheeks? Okay, so that was all good. Next, I'm going to test muscle tone and strength. So have him grip my hands and then push up on my hands and then push down. Okay, so that was all good. Next, I'm going to test cranial nerve 5, which is sensation. So I'm going to have you close your eyes, and every time you feel a touch, just say yes.
Yes. Yes. Yes. Yes.
Okay, so no problems with sensation. Next, I'm going to test cranial nerves 9 and 10. So gag reflex, I would take a tongue depressor and stick it down his throat till he gagged. And that would show me if he can swallow or not. So now I'm going to test swallowing by having him take a drink of water. Okay, did that with no difficulties. Next, I'll do the tendon reflexes. So I'm going to have you put out your arm. And when you hit this brachioradial nerve, your arm should twitch. Okay. And then the patellar reflex, I'll have you cross your legs. And you're going to hit right below the patella, and your leg should flinch out. Okay? And then Babinski reflex, and you put your foot up. And when I stroke his foot, his toes should not fan out. That's normal in an infant, but not in an adult or teenager. So that concludes my neuro assessment.